Hello. Hello and welcome everyone. Thank you for joining today. I am Dr. Piyush Patel. I am the Director for Street Dog Program at Human Worlds for Animals. Uh, Today I will be briefly sharing our 10-year journey managing street dog population and improving street dog welfare in India. It is a complex and very evolving challenge. And though 15 minutes is a very short time, but I will do my best to cover all the key points. And also feel free to reach out via email shared on the last slide for any questions. So, if I have to summarize everything in short, what we have learned in last 1 decade is that spay neuter alone is not enough, especially for India. Effective solutions require a holistic approach and which respects the cultural, legal, and community realities on ground. So before we begin, just to show you the scale and complexity of this issue, India is a home to one of the world's largest street dog population, estimated around 60 to 80 millions. And this poses a significant public health challenge as India accounts nearly 36% of our global rabies deaths. And most of these are linked to dog bites. Also, beyond health, it is a welfare and social issue. And to combat this, India runs a high volume spay neuter program, which are commonly known as animal birth control program, to control the dog population and to prevent rabies. So, talking about challenges in India, especially in urban areas, street dogs and people often struggle to coexist. And there is a of course there is a lack of proper sterilization and vaccination program, but most of the people are not aware about dog behavior, their breeding cycles, and their requirements. Also, there is a lot of misinformation and fear about rabies on ground, and all of this makes things very worse for the dogs as well. So, without a system to control rabies or to enforce animal protection laws, and with this rapid urbanization, both dogs and communities faces growing challenges in urban India. So, so talking about animal birth control processes, what we do at our program, so all the street dogs living on the streets are caught from the communities. We bring them to the facilities where they stay with us for 4 days after surgeries. And after they properly recover, they get properly healed, we release them back to the exactly same location from where we pick them up. So talking about a little bit about the history about the dog welfare in India, it's a little complex slide, but let me just quickly summarize everything. So as we all know, there's laws shape the societal changes, and along with these laws, how we as an organization has moved forward. So as you can see, before 1995, dog control in India was mostly culling and relocation, which has changed in 2001 when animal birth control rule came in existence. These rules made spay neuter is the only legal way to manage dog population, and that has made killing and relocation illegal. There has been a several amendment made to bring more transparency in these rules. But if you notice one thing, India has seen a significant increase in number of pet dogs post 2010. So to curb and to make sure that the pet dogs are also safe and protected by animal welfare, the government has introduced several other laws like dog breeding and dog marketing rules. There's pet shop rules also. All of these rules were introduced after 2017. Talking about our journey, we as an organization, we began in 2009, and that was not in India, but that was in a neighboring country called Bhutan, and that was one of the region's first high volume spay neuter program. After that, we expanded several programs in India. We started with the small campuses and institutions, but slowly we started working in the big cities as well. And when we are doing this, we are working closely with the policymakers. So till now, we have worked more than 30 different locations in a country, and we have sterilized over 242,000 dogs. So yeah, it's a very colorful slide with lot of numbers. The slide shows the number of dogs we have operated in different location year wise. But each of these program has brought us very good insight about the dog dynamic, what are the expectation of communities, uh, and what we have started believing after so many programs is that animal welfare is no longer an afterthought, but it's a shared responsibility between the organization like us, the government partner, and also community is a very important stakeholders. Now, in hindsight, if we look back and if we have to divide the entire journey, we can divide them in a four different phases. So, phase one from 2013 to 2016 was all about implementing high volume spay neuter program. So back in 2013, all of us were full of energy and armed with ABC rules. We thought that okay, if we do a maximum number of dogs, we can solve the problem. And there was a lot of researchers and experts were suggesting that if you sterilize 70% of your total street dog population, 90% of your problems are solved. So we wanted to reach out to as many number of dogs as we can, as early as we can. But in our rush to scale, we overlook very important critical aspects like operations, logistics, skill improvement of skill development of our team, and all of this has hit us very hard in one of our major program, and that was a wake up call. So the learning was good intentions need good system to support. So the phase two was all about building systems. So we shifted our focus to creating the structures like policies, processes. There was a lot of training conducted, and there was a lot of reliable systems created to support the foundation of sustainable growth for the organization. Then came the phase three. So after we had the systems at places, we began asking one important question that are we making any impact? Is our work effective? So we started using and started embracing a lot of data and started evaluating our outcomes, which has refined our approach through constant learning. Phase 4, very recent, by 2022, we started focusing on collaboration and scale. So we have evolved from running one program to shaping a sustainable model. We started partnering with local organizations, governments, and we have started developing the evidence-based solution, which could be scaled and replicated. So I'm going to quickly talk about each of these program and the important key features of this program. Talking about our first program in India, that was Jamshedpur. Uh, um, Anybody from the audience who has been to India can relate to this and who has seen dog catching happening on the streets. The conventional method of dog catching was net catching, and it gets very chaotic and stressful, not only for dogs but for the people also. And we really wanted to change that. So what we have done is we have introduced a welfare focused method, in which was human hand catching, and it was to prioritize dogs' well-being and reduce fear and probability and chances of injury. So what our team started doing was they started doing Reiki. So they started observing and offering treats to identify friendly dogs, and all of this has made the next day catching very faster and less stressful. This approach not only help our team, but it has also changed community's view, showing that street dogs are not aggressive, but they are often misunderstood. So if they can be treated nicely, they are not harmful. So the next big program was Haryana. It was a very huge program with a lot of resources in which invested by us. This program was supported by National Center for Disease Control program, National Center for Disease Control Center, and this was a pilot for National Rabies Control Program. So all of us were very excited. Just to give you an idea about the size of the program, we had 120 staff. We had more than 18 dog catching vans. We are functioning with three large facilities, and our team was sterilizing 200 dogs and vaccinating more than 1000 dogs every day. Important features of this program: because of the large size of the data, to improve the data management, we created a mobile application and database. So this was the first experience we had on ground with so much of data. This mobile application was developed to make record keeping very fast and reliable. The second important feature of this program was there were several different government partners involved in this program. So there was a lot of bureaucracy, and that was a great lesson for us, which I'm going to share in the next slide. So talking about learnings of this phase. So the first learning was government is legally bound to provide all the necessary infrastructure and funding to ensure the success of this program. As I said, ABC Rules 2023 make sure that government has to provide required resources to the implementing agency. Uh, the second learning was, okay, we are working with government. There were a lot of different stakeholders, but from our side, we needed a lot of human resources to manage this bureaucracy, the report submission. There was a lot of back and forth between government and us for approvals. So until now, we had veterinarians and paravets managing inventory, preparing budgets and reports. But now we have realized that these additional skill sets are very important to make this program, successful. Beyond government agency, we started recognizing the community is a very important stakeholder, and their active involvement can enhance the effectiveness and sustainability of this initiative. Uh, and at last, we started asking this critical question to ourselves: that do we have adequate resources to sustain this ambitious program, um, particularly when you are solely dependent on government fundings? So all of these were learning from phase one. Now, when we are doing this, there were two major incidents happened in a country. First was in Sitapur. It was a very unfortunate incident. It's a small town close to Uttar Pradesh, where illegal slaughterhouses were shut down by government, and street dogs who were relying on the meat scraps suddenly lost their food sources, and soon after they started attacking the livestock and the children in the nearby villages. So in all of this panic, unfortunately 14 children died, and the panic spread. So authority has begun killing the dogs indiscriminately. Despite no clear evidence whether it was solely responsible, I mean the street dog were the solely responsible, or were there any wildlife involved in these attacks as well. So we intervened, and we started engaging with villagers and officials, and we have proposed the spay neuter program. We knew that it is not directly related to aggression, but it has helped us calm down the villagers, and it has stopped the mass killing. So sterilization become a way to save the lives and shift the community's perspective in this case. Similarly, there was one more incident in the state of Kerala, where few dog bites have caused fear, and that has led to call for a culling. And in fact, some of the group have started killing the street dogs. So we stepped in to promote the human spay neuter program and publicly show that these dogs are not aggressive. And we encourage kindness and coexistence. As you can see in one of the photographs on the right corner, that our team member were petting the dogs, and while all the curious villagers were looking them. So the point is that spay neuter is not only to reduce or manage the street dog population, but in a human dog conflict situation, it also save lives of friendly street dogs and de-escalate the situation in human dog conflict. So the learning from all of this program were that this program were very resource intensive, and it was hard to sustain. So we shifted our program from multiple small scale program. We recognized the role of community, media, and public narrations, and most importantly, we moved out from opportunistic efforts to strategic and well monitored program. The biggest learning from this phase was that, as I said, storytelling and media plays a very powerful role in shaping public conscience and mobilizing community. The second learning was, of course, don't compromise with requirements with the government partners. Whatever is committed and written in the MOU, in the contract, has to be provided and implemented on ground. The third important learning was planning about exit. So what happens after we achieve 70%? Do we want to stay there forever? Um, whom can we hand over the program? So these were the questions coming in my mind. And last but very important is that celebrating small wins keeps the momentum alive and stakeholders inspired. So we started celebrating small events, be it a World Rabies Day or World Spay Day. We started hosting events where we used to invite all the community members, and started engaging with different stakeholders. So these are very crucial for networking and relation building. Phase 3 brought us stability, and it has a very lasting impact also. So, along talking about this exit and sustainability, we really started focusing on one of the campaign, which was Abhay Sankal. This campaign literally means be fearless. And now we moved beyond managing state dog population to involving community directly. So building trust and partnering with community became a focus now. Talking about exit, Vadodara, one of our big program, was the great example. We achieved 86% sterilization rate, and then we transition out. We handed over program to communities. Although we have our community team working at the location, but we have shut down our spay neuter program. So the learning was from the phase 3 was that we really need to focus on replicable models. So one that others can adapt and use rather than doing everything by us. We also saw a great value in strong IEC material, which help us communicate it clearly and make our program more scalable and sustainable. The third learning was partnership. You want to be a partner with all the local organizations, even if they are not for animal welfare, even if they are working maybe for children empowerment or maybe for environment or for women education. They already have existing networks, so it's always good to bring these people on your platform, because this brings a lot of trust, insights, and they have a deeper understanding about community. Finally, we were reminded that our great strength is our people, our community, our team. So investing in our team and collaboration drives the real and lasting change. This photo shows our one of our community meeting, example of local connection in action. In recent years, we have received that we started receiving a lot of requests from different municipal corporations and different community, that why can't human welfare animal comes to us and we can start a program. So and that made us really think that instead of expanding everywhere by ourselves, or why can't we build a strong organizations like ours in every state. And this led us our initiative of veterinary training and capacity building program. So rather than growing by ourselves, we focus on equipping the local organization with the skill, knowledge, and standard to continue the work. And this program covers everything from survey to planning to dog handling to surgical training to animal laws, empowering local teams to deliver quality care and sustain impact. And the last phase was a turning point. So since 2022, we started focusing on building human and sustainable models, and we started preparing our communities to sustain this program by themselves. And we realized that true self-reliance is very important for this program, and staying too long delays the handover process. So we started asking that, are the systems strong enough to survive without us? Have we built the right local leadership? Because capacity building is non-negotiable. So before we exit, the local group must have all the tools, knowledge, and support to sustain this program. Because real impact is not about how long we stay; it's about about what lasts after we leave. So if the sterilization stays above 90% 3 years after our exit, that's the real success of this program. So this slides sums it all up. Managing street dog population is not just about spay neuter; it's a system. It starts with laws and policy, followed by survey, protocol, and community engagement, and then we need trained people, infrastructure, sustainable funding, and all of this doesn't end there. Ongoing monitoring and ecosystem building are the key to make this program long last. So all of these steps equally matter. Uh, Thank you so much, everyone. And now we can open for question answers. Thank you.